Well, hello, Dr. Ghatan. How are you doing over there in New York? Snowed in?
A little cold.
A little cold, okay. All right. Well, Dr. Ghatan, at one point I had a conversation with you, and you mentioned to me something I didn't know, that people actually they split their earlobes. They really hurt and harm their earlobes. Can you shed some light on that and tell us what this is all about?
Sure. It's a very common problem. Torn earlobe or split earlobe is a very common problem. And there are a couple of reasons for it. One being people who wear very heavy earrings, it's going to weigh on their ear, and it's going to gradually pull through, and they'll notice the hole is going to become larger and larger to the point that it's hanging, the earring is hanging in unsightly, or it may pull through totally. The other thing is some people have the habit of having the earring in the ear all the time, and then when they take off their clothing or when they go to sleep, they tend to pull on the earring, and that's how they get their split earlobe or torn earlobe.
Basically, it gets caught in a sweater or whatever, and you go boom and off, and it kind of like you literally tear it out.
Right, or if sometimes you're holding a little baby in your lap and they stop playing with your earrings and they pull it so fast.
That must hurt.
Yeah.
So what can be? So what? That's when they come to you?
Yes, oftentimes they come to us after the acute episode, meaning that it's already torn, and it's not bleeding anymore, and it's healed, but it's torn and you cannot put on any earrings, or it's become so loose that the earring is hanging in one ear compared to the other side. The earring is going to be uneven, so they come for help for that. And the treatment is very simple. We just give a local anesthetic to numb the area, and then we freshen up the skin, the tips of the skin where the tear has happened, and then we suture it back together. I tell the patients that you're going to have this usually for about 2 weeks, and you can have a new hole made in 2 weeks after, but I caution them not to make the hole the same area where the stitches are done, because that is going to be a permanently weak area, and it's going to pull through again very, very soon. So it's best to make a new hole next to the area, but not in the same area where the previous tear happened.
Okay, all right. So let me ask you, would you, I mean, I know this is a personal thing, and probably most ladies, no matter what you say, will probably not change on how and what they do, but do you think it's not a good practice to have holes in your ear and put earrings on it, or just be a little careful and there's a few things you shouldn't do, and if there are, tell us what they are?
Well, I think it's a personal thing, and it does add to a person's appearance. And I know ladies who feel they're not really properly dressed if they don't have the earrings on. It affects them emotionally. And it's like some ladies don't want to go out without makeup. Some ladies don't want to go out without the earrings in the ear. So it's a personal matter, and it has to be dealt that way.
Okay. So basically, just be careful. And of course, there are the clip-on earrings. I think that's what my wife is wearing. And I don't think she has any holes in it. I shouldn't say that I don't know, because that's not good after 25 years, but no, I know she doesn't. So, but again, the ladies who will want to do it, they will do it anyway. So just be careful, I guess. Realize your baby. Maybe if you hold your baby, go and put smaller earrings on at least, not the big ones where the baby can put their whole hand in it and then pull on it, right? Something like that. Well, all right. Good. Thank you very much. Thanks for your insight in earrings, and that those type of things happen. Bye-bye.